Hey guys, Nurse Mike here, and welcome to SimpleNursing.com. Check out our brand new app and get access to our new pharmacology and med-surg mastery courses, plus a massive quiz bank loaded with detailed rationales to test your knowledge. Join for free. Click the link in our description below. For the top 2 missed questions for cancer pharmacology. Question number 1. When preparing to administer Tamoxifen to a patient with breast cancer, the nurse is most concerned by which patient report? So, this question is asking for the most concerning, for the key problem, administering Tamoxifen. So, typically when you hear the word most concerning, just think who dies first, or what's the worst case scenario? And we're always thinking ABCs, airway, breathing, and circulation. Okay, so before looking at the options, think of the 2 things you know about Tamoxifen. So, the double E's, E for emboli risk, which means a clot risk, and E for endometrial cancer. We report heavy bleeding. 2 big circulation issues for our ABCs. Option number 1. I have been experiencing really heavy menstrual cycles recently. So we have to choose this as correct. Guys, even if you don't know what this medication does, this technically says heavy menstrual cycles. So we just think ABCs. In this case, circulation means bleeding. Now, option 2, my hot flashes seem to be decreasing in frequency. So this is incorrect. Decreasing hot flashes is actually a good thing. And by the way, hot flashes are to be expected with tamoxifen, since we call it Tamoxifen, basically hot. Now, the last 2 options are also incorrect. So I feel like I may be developing a sinus infection. So no, sinus infections are not the top priority here. And lastly, I just don't have energy for sex the way I used to. So no, sex is not a top priority. Well, at least not in this case. Now, question number 2. The nurse is caring for a client with ovarian cancer taking Doxorubicin. Which assessment finding should the nurse report to the healthcare provider? Select all that apply. So this question is asking for a priority finding. Which assessment finding should the nurse report for the key problem taking Doxorubicin? So before looking at the options, a little side note here. All priority questions. Guys, always think, what kills the patient first? So remember, let the question help you. When you see words like assessment findings to report, or most concerning, or even first action by the nurse, this always indicates a worst case scenario. Basically, a priority question. Always ask yourself, what kills this patient first? Now, in this case, Doxorubicin, even if you don't know, just let the name help you here. The question states that the client has cancer, and the worst case scenario is a chemo drug that kills all the blood cells in the body. So we have low blood cells. So just think low RBCs, we have anemia. Low WBCs, we have infection and fevers, over 100.3, and we have low platelets, big bleed risk. That's technically what kills first. So, looking at our options. Option 1 is incorrect. Partial thrombin of 55. Technically, PTT is normal between 46 and 70. And it's not technically a cell, it's a coagulation factor, typically not affected by chemo. But this is a good try. Now, I can see if you were thinking platelets, which is option number 2. Platelet count of 48. Yes, we have to choose this as correct. Huge risk for bleeding. So remember, platelets less than 50 is very risky. Big bleed risk, because normally it's 150 to 400,000. Now, option 3, red blood cell count of 5 million. This is normal since 4.5 to 6 is the correct range for RBCs. Now, the last 2 options are both correct. A temperature of 100.7 or 38.2 Celsius. Yes, this is a fever, so remember the key numbers here. 100.3 indicates a fever with any cancer patient. Now, lastly, option number 5, white blood cells at 3,600. So yes, this is less than 4,000, so it's critical for chemo patients. Normally, to 10,000 for the NCLEX is normal. All right, guys, that wraps it up for this segment. Don't forget to take your quiz and download the study guides. Thanks for watching. For our full video and new quiz bank, click right up here to access your free trial. And please consider subscribing to our YouTube channel. Last but not least, a big thanks to our team of experts helping us make these great videos. All right, guys, see you next time.